The two on the left, I think, are extremely important, even though the kind of heavy science stuff is on the right, but I'm going to explain why. So computer science and technology. We've had enormous advances in terms of miniaturization. Just look at your smartphone. Look how powerful it is now. I mean, I'm assuming people generally have smartphones, right? Because most of us will do. But over the last couple of years, they do more. There's more apps. There's more ways they can monitor us, track us, get us to integrate and interact with other people. So there's been tremendous advances in terms of the actual hardware, in terms of how we analyze software with big data, with being able to store information in the cloud. And a lot of industries outside of healthcare are capitalizing on this in a big way and investing in this in a big way. I'm going to mention genomics and brain science. So I mentioned at the start neuroscience and brain science, and for a very long time I was very gung-ho about neuroscience, right? It's going to change the field. But then the deliverables, I've not seen that in clinical practice. But I think that now we are getting these new kind of machine learning ways of analyzing data using machine learning, and computer science is almost like a jetpack on the back of neuroscience research. We know a lot of neuroscience research isn't replicable, but with data science, we can take in huge amounts of data and almost let the computer find out the associations. We don't have to come out with a hypothesis. Genomics is another example. For a very long time, people have done genomics research with increasingly large samples. And it's only really in the last few years that we've actually started to find genes that are associated with these various conditions. And what's interesting about these genes is that there's a tremendous amount of overlap between different conditions. So these discrete conditions that we kind of think about them in specific boxes are actually connected to others, like up to a third or more of the genetics can be shared across the board. And I'm going to say cultural and business, and I'm going to slot in design thinking here as well, because there's some cultural and business changes that I want to highlight for you. And that leads on to the innovation area. And you're all kind of innovators for being here, right? So I'm speaking to a subset of people who've seen this topic and said, hey, I want to find out more about this. So the first thing is, what is a different brain and what is a disordered brain? So we deal, in terms of some of the kind of startup work that we do, we think about product, and some of the people that we talk to say, hey, don't call me a person with autism, I'm an autistic person. And this is a lot about identity. But we need to understand that because this is going to affect how people get care and interact with you. Whether you have a clinic, whether you have a product that you've designed, knowing what their perspective is, and their perspective may be different. You may get 100 people with autism or another condition with borderline personality disorder or something else. 20% will say, hey, this is just me with a different brain, but 20% of those people may be very impaired and need very high level of services. So understanding this spectrum and changing your language and how you advertise your services or products is actually extremely important. So the other thing is that there's been a lot of changes in terms of, is cannabis something we should research? THC, is it something that should be legal or illegal? And people are actually looking at psychedelics. So things like psilocybin, the substance in magic mushrooms, or MDMA, the substance in ecstasy, and thinking, can these substances actually help enhance psychotherapy? And there's a lot of recent research and ongoing research that's happening in a kind of a little bit of a murky area because some of these substances are actually illegal in the US, both of them. And but people are actually wondering, hey, previously we've just shunned these aside, just like the entire kind of cannabinoid system of the brain. And we've said, hey, cannabis is illegal, no one wants to touch it. But really, should we spend a little bit more time finding out how these things could affect our patients without getting mired in the kind of politics? And with that said, this was a recent paper in the Green Journal, the American Journal of Psychiatry, and it looked at antidepressants, people who are taking antidepressants for depression. And then it started saying, what would the authors recommend based on their review in terms of nutraceuticals? So things that you can buy over the counter like vitamin D, that they think, based on the current level of evidence, will potentially be helpful for patients taking antidepressant. And they came out with these. And I certainly know of some very high-powered clinicians with very high-powered private practices who recommend some of these even for kids. Omega-3, I've definitely suggested and used that with some reasonable effect for mood and inattention. But again, research is limited, but this was in an article in the American Journal of Psychiatry saying, hey, if you're on antidepressant, these substances may actually augment it. So again, looking past our just psychotherapy and psychopharmacology to some extent and saying, hey, what's over the counter? This is an interesting slide, and this relates to us a little bit, and it relates to the beginning when I asked, who is in the audience? Because people have very different ways of thinking about things. So as a clinician, I often think about, okay, so what's the diagnosis? Sure, but what is the patient complaining about? What is the issue that I can potentially help with? So what are the symptoms? Oftentimes when I talk to neuroscientists, depending on their neuroscientific background, most often actually nowadays I talk about circuitry. So, you may often see patients coming in and saying, well, isn't it a brain imbalance or chemical imbalance? And I try not to get too far into that. I just say, I think for some people it's a matter of circuitry, for some people it's something else, some people it's very much relationships. But neuroscientists often think about circuits. Technologists think about code or an app that they're going to run, or some of the more nuanced technologists may start to talk about systems. What's in their system? So what's the hardware component? What's the software component? How is it running? How is it being powered? All these different aspects. And startups, which I'm going to come to in a minute. So what do you do in a startup? You think about a product because you're trying to build something. And ideally build something that people want, right? There's no point having the fanciest, greatest tool for use in for schizophrenia or OCD if no one's going to use it because the user interface is horrendous. So one of the reasons that Apple is so successful, because they have a user interface and a design that people are very comfortable with, and it's very usable. So in startups, we think about products. What am I missing here? I'm missing the patient. So where's the patient's perspective? And that's, again, incredibly important because the patient can actually have a background in all of these and expect certain things. So some of the people that I may see in Silicon Valley, for example, if they work in a software type of startup or a technology startup, they have a particular way of assessing how I'm assessing them and their expectations. What is the thing that I'm going to offer to them? How will I reevaluate it? They're doing the lean startup kind of thinking. So with startups, people are interested in mental health. Mental health is a hot topic. So for so long, people have kind of sidelined mental health. Like, we're weird, mental health is weird, this is not important. But it's actually garnering the attention of lots of very important people. And the amount of startups in mental health is actually rising dramatically. There's a list called Angel List that you can look at. It looks up all the different kind of companies, commercial companies doing startups. And that's had a really dramatic rise in startups that have come onto the scene. And there's like 255 as of a week ago or so, and 120 of those have happened in the last year. And we're seeing a lot of this startup growth is in the US and the coast of the US, but Australia is also represented, and there's people all over the world that are looking at this issue. And what are they looking at? So what are they trying to actually do? So they are looking at trying to match the right clinician to the right patient at the right time. They're trying to understand, how can I use a piece of technology to understand a change in someone's mood? And I'm going to talk a little bit about that shortly. They're trying to use these wearable devices. How many of you have a Fitbit or some other tracking device that you use? Any more than that? Yeah, okay, good. Okay, so people are using these devices, they just wear them, and it just gives them a little bit of insight. And I've suddenly heard some of my colleagues or friends say, hey, it's really funny, last week I only did 60% of my normal kind of walking, whereas normally they wouldn't have paid attention to that. But then they actually look at their behavior. It's actually interesting for some people. Virtual reality is going to be really big, and I'm going to talk a little bit about that. Virtual and augmented reality. We're seeing a lot of money in the US, a lot of interest flow into these areas. Social media monitoring, I'm going to talk a little bit about that, but some people actually see social media as an extension of ourselves. So think about it as what we, say for example, tweet, when we tweet it, what the structure is of a tweet. How many people are on Twitter here? Okay. How many people are on Facebook? Okay, let me go. So when we think about Facebook, it's what we post, when we post it, who we engage on Facebook, how people engage with us. And now, have you noticed Facebook has those extra emotions that, again, it's kind of deepening this level of interaction. And Facebook algorithms are trying to work out, hey, if you've actually, expressed wow or sadness or these different emotions several times in a particular length of time, is that the right time to show you an advert for product X or product Y, especially if you've been searching for it on some other area and they know you're interested. So again, commercial companies are ahead of the curve in terms of finding out how they're going to get us to buy and purchase things. Patient portals, peer support, video and text therapy, again, like SMS text or other messaging apps, and patient education. So there's a lot of areas that are being looked at.